So before we get started, I want to pose another question, which will pop up on your screen. And this is a yes or no question. How many of you ladies at home feel as though most nights you get a good night's sleep and wake up feeling well rested? So when that pops up on your screen, please answer yes or no. While we're collecting your answers, let's talk about why sleep gets disrupted in menopause.
Look at the results coming in.
So women spend their reproductive years accustomed to changes in hormone levels. So for most of our adult life, women get used to the monthly cycle of hormone levels. And they're predictable to you, they're predictable to your loved ones. Then we hit perimenopause. And during the perimenopause, our hormone levels become very erratic. And that can sometimes make us feel a little kind of off kilter. And then we enter menopause, where our hormone levels are consistently and persistently low. And for most, here we go. So here, if you can see on your screen that during in our reproductive years, there is a nice up and down predictable cycle. And then in perimenopause, it becomes very irregular and erratic. And then in menopause, it settles into that low phase. And so the average age that women will hit that low phase is age 51. And that happens because our ovaries have run out of eggs. And so there's nothing there to help continue to make estrogen. So you can take down that slide, please. And I'm going to share with you the results of the poll, which is 90% of you do not feel like you get a good night's sleep most nights and wake up feeling well rested. 10% of you do. And so let's talk about how we can reverse that so that for the next chat we have, it would be the opposite. And the majority of you are having a good night's sleep. So one big reason why women's sleep is disturbed in menopause is night sweats. Night sweats can begin several years before that final menstrual period and can last for more than 7 years after that last period. And because they can last so long, it's not a good idea to just tough it out, especially if it's disrupting your sleep. So, Dr. Steele, if a woman is woken up out of sleep because of a hot flash, why is it so hard for her to fall back to sleep? Why is that so disruptive?
The first part of that, it's a multifaceted answer, right? Because hormones are so complicated and so are humans. And so with that, when we really think about it, you go to sleep, you have an expectation that it won't be terrible, right? I mean, we all expect to toss and turn and wake up and all of that. But I think when you're jolted awake like that you are, and I'm a little bit younger, but I've had one and I thought I was going to die. It was so terrible. But because you do jolt up and you wake up in such like a startle response, that then now you're activating your whole system in a very different way, right? You're going from 0 to 100. And in those moments, I really think that women have a hard time falling back asleep because now they're amped up, they're elevated, they're hot, they're uncomfortable. Nobody wants to lay in wet sheets, right? Changing clothes. I mean, realistically, there's a lot of things that go into that. The other part is, let's say somebody has been toughing it out, right? Maybe that's what they were taught. Maybe that's what they were told. Mm-hmm. And now their emotions are associated with kind of like being in a irritated annoyance, right? Kind of feeling that. Mm-hmm. And we start to fight against that. We really start to fight to say like, this is so agitating. And that's just not a good space for us to wake up. That's not a good space for us to also try to go back to sleep in a calm manner.
So when that happens, what can we do to help put us back into the sleep mode?
part of it, and it's going to not necessarily be related solely to night sweats, right, is that how we think about kind of going through the transition in general. Historically, women have been told that this is going to be a really terrible time, that you're going to be really irritated and that it's not going to be pleasant. And when we go into a phase of life with those types of thoughts, and it's going to amp up those negative emotions. And so part of that is trying to accept that this is a little bit of a disrupted time, right? We can't control some of the hormones that happen at times. So not toughing it out, but also some acceptance. In terms of sleep hygiene, right? Those are probably buzzwords that people have heard lately. And what can be really helpful is to kind of take those steps to maybe reduce some of it happening. So not eating super large meals before bed, trying to stay away from like super spicy foods or acidic foods, alcohol, things like that in terms of diet and lifestyle can be really helpful in reducing some of them. The other part is, let's say you do have a really healthy lifestyle. It can be potentially trying to get some of like the cooler sheets so that it's not so temperature, like it's not so hot in bed, right? Changing those sheets from winter sheets to maybe summer sheets if it's just trying to go with the seasons.
No more flannels.
No more flannels. And don't wear flannels, right? Wear something that is a little bit more cooling. So some people like to wear like workout clothes if they prefer to wear clothes, something loose that's a little bit more water resistant. And also you can also sleep naked, which goes really well with our sex talk that we'll get to.
2 for 1.
2 for 1. And also just trying to kind of keep the emotional sense calm. If you're laying in bed, you're uncomfortable, try not to lay there for a really long time, right? Then we're just fighting ourselves to go to sleep, and it's going to have the exact opposite effect, right? If you're tossing and turning thinking, I can't go to sleep, I can't go to sleep, you're not going to go to sleep essentially. So trying to find something relaxing.
Right. A few other tips that sometimes can be helpful are products like the chili pad, which is basically a pad that you put under your sheet and you plug it into the wall and you can set the temperature. So even if you do want to have a blanket over you, your body temperature remains consistent so that it's not pushing you into a hot flash. Another poor man's version of that would be to take a bag of frozen vegetables, put it under your pillow, and then throughout the night, flip your pillow so that your cheek's always touching the cool side.
I like that.
Sometimes those little tips and tricks can be helpful. And please start submitting your questions about sleep and sleep problems. And we can get to them in a second. There are some supplements that can be helpful for sleep. Melatonin is an oldie but goodie. Magnesium is helpful. And there are also several prescription sleep medications. And I love this study that was done years ago that had women coming into a midlife clinic, and they had their laundry list of problems and symptoms, and their doctors did one thing only for them, gave them a sleep medicine. And just that one thing made everything else on their list a little better. So I really can't emphasize enough how important sleep is. And I think it is the rare human who doesn't need 8 hours of uninterrupted sleep. Most of us really do. And even though we might think we can get away with less, we're probably fooling ourselves. And one of the first things I tell my patients is, if you're not getting good sleep, figure out what is disturbing it and let's try to fix it. I think like a snoring partner is a big one, or a dog that moves around.
Absolutely. It looks like there's something in the chat. Let's take a look.
All right, so we are going to try to get your questions.
Feeling overheated, uncomfortable without actually waking up. Is that still considered a night sweat?
So this is a good question. If you are waking up and you're feeling overheated and uncomfortable, but not actually wet, is that a night sweat? And so, yes, night sweats come in many different shapes and sizes. It essentially, like what a hot flash is your body's overreaction to a small temperature elevation. So for most of our lives, our thermostat works pretty well. Mm-hmm. And unless we are out in the, when it's really, really hot, or we're in in cold weather, we can manage our temperature pretty well. When we go through menopause, our thermostat becomes very overreactive, and small temperature elevations make our body feel as though we're on fire. And so your body starts sweating and flushing to try to get rid of as much heat as possible. And sometimes it does it so effectively that, we end up dropping our core body temperature and we're shivering. So the reason that's important to know is because anything that you can do to prevent you from feeling overheated or increasing your body temperature can prevent how many hot flashes you get and how severe they are. So the answer to that question is just feeling hot, not necessarily sweating is a hot flash. I've had patients who they just feel this impending sense of doom, and they might get a little kind of flushed or blushed looking, and that's all it is for them. If it's disturbing you, if you're noticing it, then it's a hot flash. Another good question that came in was, I was premenopausal in my 30s, and now I'm hearing perimenopause. Is there a difference between early onset menopause and perimenopause? And yes, there is a difference there. Early onset menopause or premature menopause, another word is premature ovarian insufficiency. Those are all a diagnosis of your ovaries not having the eggs that they need to secrete estrogen. So you're in menopause earlier than when you should be, which is on average the age of 50. Perimenopause are the years that lead up to menopause. And those years leading up to menopause is when your hormone levels start to become really erratic, and the symptoms that can be common during that stage are having irregular periods, having hot flashes and night sweats. They usually happen right before your period's about to start. So it's not like it's every day, or it's not as persistent as when you're actually menopausal. And mood changes are also pretty common during that perimenopause stage. So that there is a difference between those two things.
Can I ask a question?
Yes.
How would somebody be able to know what stage they're in? So let's say somebody's experiencing some symptoms. They're kind of in the age range, but they're not quite sure hormonally where they're at in the cycle. How would somebody be able to test that?
That is a great question. Usually the answer is not hormones. So a lot of patients will come in and say, can you check my hormones so that we can see where I'm at? And the problem with that is that hormone levels, particularly ovarian hormone levels, can fluctuate pretty quickly, meaning that if you're in that perimenopause stage, you may look in the menopause range one day, and then maybe the next day you look like reproductive 20-year-old stage. So the best way to know is your symptoms. And if you still have your uterus, your periods are a great sign of what's going on. If your uterus was removed, or you've had an ablation, or you have the Mirena IUD and don't get periods anymore, then we can't rely on your period as a marker or a thermometer for what's going on. But sometimes the other symptoms can be helpful, like the hot flashes. So that was a good question. Okay, we got some more questions. So how often should sleep aids be used? All right, I have an opinion about that, but do you want me to take it first? Or?
Yes.
Okay, so how often should we use prescription sleeping aids? And I think that there is a role for using those sleeping pills to get someone back into the habit of good sleep. Because I think for many women, throughout their life, something started disturbing their sleep. Like maybe when they were pregnant, they were waking up because they're uncomfortable. Or then there's a baby or a kid that's waking you up at night. And then there's a dog or a spouse that's snoring, and then you have to go to the bathroom. But for whatever, there's so many different things and events that can start disturbing your sleep. But then it becomes a habit, I think, where, it's 1 o'clock, might as well go to the bathroom. And I think as you're tackling those and preventing those things that will disturb your sleep, sometimes a sleeping aid can help just get you into a better sleep pattern. The problem is that you can become reliant on those sleep aids. And I've found that it's often hard to get patients off of it. So my preference is to rely on the other ways of helping sleep rather than rely on those. But there definitely is a role. And for certain patients, it's beneficial. Do you think that too?
I would 100% agree. It really takes a long time for our sleep to become regulated at a pretty consistent basis. And then once we add in a new stress, we kind of have to readjust a little bit to make sure that it stays consistently good. And so using some of those techniques, you could literally Google sleep hygiene and find, going to bed at a consistent time, turning off the TV at a certain amount of time, decreasing water intake so you're not going to the bathroom, or at least increasing your chances of going more frequently throughout the night. And so trying to find what works, but also working through the emotional piece that can come with sleep. We don't want to try to go to bed with strong emotions because we're probably not going to get very restful sleep. So definitely trying to find some of those other strategies to help, some mindfulness, some relaxation. Now, be very cautious or cognizant that those things won't help you go to sleep, but they'll help you create a routine of relaxation that might put you in a better space to go to sleep. So some of those can be really, really helpful.
I like that. I also think that so many of us are obligated to be on screens throughout the day for work. And then that's often the way we communicate with our family and friends. And that blue light is very disruptive to our sleep. And I think especially, I was in the habit of scrolling through Pinterest before bed as my relaxation mode. But I've stopped doing that because I really think, do you agree?
Absolutely. Absolutely. Trying to turn off laptops, phones, and TVs about an hour before bed can be really helpful to just calm our mind. Oftentimes I hear that people will, want to go to sleep or look on Pinterest. Like, I'm guilty of that too. But the problem with that is that we're then become very interested in the storyline, right? If we're watching a TV show that we like, we're not shutting our brain down. We're getting more excited for the next episode. Same with like YouTube videos or Pinterest or social media or a conversation, right? We don't want to start a really intense conversation because we're going to work ourselves up right before we're trying to calm ourselves down. So just being kind of cognizant of the activities beforehand and what it is actually doing to your brain and your emotions prior to trying to calm down.
Yes. 100%.
We have a lot of questions in the chat.
Oh boy. Okay. So let's go through a few more questions and then we will kind of flip over to our other topic of the night. All right. So one question that came up is, I'm not waking up because I'm hot or having a hot flash. I don't know why I'm waking up. And I hear that a lot. Do you what are your strategies for a patient who maybe doesn't know what is disturbing her sleep, but they're definitely having their sleep disturbed?
I think it can be a good look to kind of look over the day, to kind of say like what was happening throughout the day, because there are so many different things that can impact that. If our stress levels are up, or if we have something big the next day, then, we're not able to calm our mind down. Usually it's the opposite, where we will be thinking about our to-do list, right? If you're a to-do lister, keep something kind of by your bedside to just write it down, even so that you're not trying to remember or remembering to remember the next day. That I find can be very impactful to restful sleep. Or like that, just kind of the emotions, the behavioral piece that just naturally elevates our awareness that's not congruent for falling asleep peacefully.
Okay.
Yeah.
And so it's 2:00 in the morning, you're awake, you don't know why. What do? Do you get up?
Yeah.
Do you stay in bed?
I think it depends on the person. Here's what I would absolutely recommend is if you are laying in bed for more than 15 minutes, you're wide awake, don't lay in bed. What's going to happen is that there will be some negative associations with bed, right? Now we're tossing and turning. Tomorrow's going to be terrible because I'm not sleeping. And now we've already predicted our mood for the next day. So that's kind of also what flows into the next day. So get out of bed, but try not to put on your favorite show. Try not to go open your favorite book. We don't want to engage in something that's overly stimulating, but grab some water, maybe kind of sit on the couch, try to change up the environment a little bit. And when you feel ready to go back to sleep, go lay in bed and try to do that. But it's not super helpful to lay in bed for an hour trying to get back to sleep.
Okay. All right. And I totally do that. If I'm awake, I'm like, oh, now my day is going to be ruined.
I have to get up in 2 hours. Oh my gosh. Right. And then we watch the clock and it just totally impacts our whole day.
I hate when that happens. Okay. We're going to answer a few more questions about sleep, and then we're going to go on to the second symptom of the day.
Okay.
Okay. So, there's a few questions about vitamins, minerals, or supplements that can help with menopause symptoms in general. And that's a great question. It's kind of a teaser for the next menopause chat, when we'll talk about how and why our hormone levels change, and then what we can do to tackle some of those symptoms. But there are some specific questions about black cohosh. And black cohosh is one of the over-the-counter supplements that has some data that it might help specifically with hot flashes. In general, there is no supplement that has been proven in good studies to be better than just taking a sugar pill. So it is extremely rare for me to say or to recommend that a patient go out and buy a supplement. But if I have a patient who it's working for them and she swears by it, then that's wonderful. For most patients, it's not going to be harmful. Of all the supplements out there, I think black cohosh is one of the ones that are more likely to have an effect. So if you were going to want to try something, black cohosh is probably it. And then for sleep, melatonin and magnesium can be helpful and have been for many patients.
I would even try maybe some calming teas too, even though they're not necessarily
like chamomile.
Chamomile, or there's some sleep tea that you can get on the shelf. Some people report really odd dreams and drowsiness with melatonin. So if people do experience that, there are other options to try to have, something calming before bed that might not have the same type of reaction.
Very good to know.
Mhm.
I did not know that.
Yeah.
And then I'm going to answer one more sleep question. And it's a patient who was surgically menopausal when she was young. And even though it's been several years, is still having hot flashes. And that is not uncommon. We used to think that from the time someone hit menopause, that hot flashes would last about 2 years and then they'd be done. And now we know that on average, they'll last about 7 years. And I certainly have patients who it's beyond 7 years and they're still having hot flashes, especially when someone is so young when they go through menopause. Those symptoms can persist. And definitely, I would recommend that you talk with your healthcare provider about what medicines you should be on. If hot flashes are the major disruptor of sleep, then in the right patient, estrogen is highly effective and it's actually very safe. We're going to talk about this in our next menopause chat, but there is a lot of concern about particularly the risk of breast cancer with estrogen. But compared to having a sedentary lifestyle or being above your ideal body weight, or even having a serving of alcohol a night, estrogen has a lower risk of breast cancer than any of those things. So it actually is very safe in the right patient. And again, is highly effective and has other benefits as well. But we'll talk about that next time. So I want to move on to the next factor or symptom that predicts a great quality of life, and that's our sex life. So I want to do a quick audience poll. How would you rate your sex life? Awesome, satisfactory, okay, or non-existent? All right. And then while we're waiting for these answers to come in and they look awesome, we talked about how estrogen levels decline in menopause and how it causes many symptoms. And the majority of symptoms eventually will go away. But there is one symptom that does get progressively worse and worse, and that's vaginal dryness. And that's because the vagina needs estrogen. Without estrogen, the vagina becomes less elastic and less moist, and that can make sex painful. Half of menopausal women have pain with sex. And who would want to do something that hurts? All right, so with that in mind, I'm going to pause and let's look at our poll results. So 43% of you say that sex is non-existent. The next majority would be that 27% of you say that sex is okay. 16% say that it's satisfactory, and 14% say that it's awesome. Okay, so I think that's pretty consistent with what I hear my patients telling me. Would you agree?
I would say that's pretty consistent with my behavioral health patients that I see. Okay. Absolutely.
And you're going to get probably a biased patient because they're coming to you probably because they want.
We would think so. But also I have a lot of patients that don't actually come for sexual health. And when I ask about it, we do have conversations about how it's not pleasurable, or a lot of my couples also experience what they say is like non-existent sex lives.
Okay.
Yeah.
All right. Well, let's talk about how we might be able to flip this so that we have the majority having awesome sex lives and less having non-existent sex lives. And for those participants out there who are not in a relationship and sexual health isn't as important to you, please stay with us because there are some things that we're going to talk about that are definitely relevant. So let's talk through it. Vaginal dryness is an extremely common symptom of menopause. And the reason it happens, as I had alluded to, is that the vagina, when it's deprived of estrogen, starts to become less elastic and less moist. The good news is that is preventable and fixable. And it is very reasonable that you can get back on track so that your menopausal sex life is actually the best sex that you've had of your life. Sue, can you share the slide, the next slide? Okay, so this is a little diagram that shows the difference between a menopausal vaginal tissue and vaginal tissue that has estrogen. And the as you can see, without estrogen, which we would have in menopause, the lining of the vagina is thin. It is less, there's less blood flow going to that area. And there's less ridges in it, which are, that's part of what makes it elastic. And that tissue is much more fragile. And so during intercourse, it's more prone to micro trauma, bleeding, getting cracks or fissures. In addition, without estrogen, our vaginal pH changes. And when the pH changes, that makes it less of a good environment for the good, healthy bacteria. And it's an open invitation for some of the annoying bacteria that come in. So for that reason, estrogen can be a very healthy therapy. Sue, can you go to the next slide? Okay, so there are, and this is the great news. Over the last decade, there have been so many good products that have come onto the market. Mm-hmm. So let me share some of the more popular ones and some of the newer ones with you today. So the kind of old school, has been around forever, is estrogen cream. So that's right in the middle. That's that top middle picture there. And that cream is actually estrogen. It's the same type of estrogen molecule that your body makes naturally. And women would use this usually by applying a small amount using kind of like a dipstick to the top of their vagina, and they would do it about twice a week. It can be very effective. It's just very messy. Mm-hmm. And most patients that I see eventually stop using it because it's pretty annoying. The suppositories that you'll see on the far left, those are a little easier to use. They are, thin. Most of them come in as a small tablet size with a waxy suppository consistency. And you would use those usually the same twice a week. And then you just place them as high in the vagina as possible, and it dissolves and provides estrogen to that tissue, so it can become more like it was, when you were reproductive age, which is what the goal is. On the top far right is a product called the S-string, and that is a vaginal ring. It's like a thick rubber band, and it secretes in a time-released fashion estrogen, and that can last for several months. And you would put that in yourself, and then every 3 months you take the old one out and put the new one in. So that's nice because you don't have to think about it. You just have to remember to put a new one in every few months. There are two newer products that have been on the market and have come to market these last few years. One of them is an oral medication called Osphena, which is a selective estrogen receptor modulator. And what that does is it binds to estrogen receptors, mm-hmm. specifically on the vaginal tissue, and makes them think that there's estrogen around. So this is not an estrogen. You take it as a daily oral pill, but it's highly effective at restoring that vaginal tissue the way it was in the reproductive years. So that's a really cool product, and it's highly effective. The second newer product is in that bottom right-hand corner of your screen, a suppository called Intra Rosa. And that is not, it's a suppository. It's not estrogen. It's a weak male hormone that we all make in our adrenal glands. It's called DHEAS. I'm not going to say the full word because I'll live it up. But that suppository dissolves and it's metabolized into a weak estrogen. And that is also highly effective. That's a daily suppository use. So those are just some of the products that are very effective at restoring your vaginal tissue. And then that translates into not painful and hopefully enjoyable sex. Sue, can you go to the next slide?
And so are all of those prescriptions?
They are all prescriptions. But what I want to talk about next are some of the non-prescription. How can I plan that better? So there are tons of vaginal moisturizers that you can buy over the counter. And I have a picture of a few here. Replens is a popular one. Juvagine. New Eve is a picture in the bottom right-hand corner. And these are different than lubricants because you're not using them during sex. You use them the way you'd use a moisturizer on your face if that skin was dry. And you use these products about 3 times a week. And that can be very effective. These are non-hormonal. So even if you have a reason to avoid estrogen, like a history of breast cancer, these are completely safe.
Good. Nice options.
And now these aren't to be mistaken or used instead of lubricants. Finding and using a good lubricant is very important because you want to avoid those rug burns or tearing that I was talking about. So you can take down that slide, please. So we can easily, for the most part, fix vaginal dryness. But low libido, I think, is another big challenge to having an enjoyable, healthy sex life. And if any of my patients are listening, you would have heard my analogy of libido being like a pizza pie. And some of the slices of this libido pizza pie are being well rested. That's why we talked about sleep first. Feeling good about your body. It is not uncommon that women entering midlife have gained several pounds and just don't feel their best. We are going to talk about that in a future chat, so stay tuned. And having a good relationship with your partner. To some degree, sex is a window into the relationship. And so if there's issues going on there, then it's going to be hard to be intimate with that person. Came out. Patients were having really great active sex lives. And the only thing that changed was that they were thinking about it again. But so remember that having a good active sex life not only is important and healthy to maintain the relationship and to keep the relationship well and alive, but just to be selfish for a second, it is going to translate into you living longer and you having an improved quality of life. So I think that, if I could stress one thing, this won't be the only thing I stress, but it is important beyond just the physical activity of that night.
I would say too, that part of that is like that type of communication. I oftentimes have patients throughout the lifespan who don't know what type of touch they like. When I ask like, what would good sex look like? They don't know. And so part of that is trying to kind of explore to increase that as well. Because like you said earlier, we don't want to do something that hurts, right? So being open to finding either types of stimulation that feels better, using some type of lubricant to kind of help. But also we don't want to engage in something that doesn't feel good. So even if it doesn't hurt. So trying to really explore for yourselves what that type of touch feels like. And I think that's what 50 Shades of Grey really helped women do, is they started to think about maybe expanding their comfort level a little bit, or might have brought them to one of their own sexual experiences that was really pleasurable. So kind of thinking about that too.
Very cool. If you at home have any questions, particularly about vaginal dryness or low libido, please send them to us. We want to try to answer a few before we wrap up the evening. I also have several patients who it may have been a while since they've been sexually active, and the last time they were intimate, it was a little uncomfortable, so they're a little gun shy. Dr. Steele, can you tell us about a product called the O-Nut that could sometimes help in situations like this?
Yes. So I love the O-Nut. I learned about it at one of the sex therapy conferences, and what it can help with is penetration depth. So if you are somebody who struggles with penetrative sex, and it's painful, it feels really uncomfortable, this is a product that is little rings. They're rubber, so they're very soft. And you would use that with your male partner or a female partner with a penetrative device. And you can customize it to the penetration depth that you would like. So the little rings, I think one pack comes with 4 or 5. Place it over whatever will be used to penetrate. And then if it still feels a little bit like it's too deep, then you can just add onto it to help create a more shallow but still really pleasurable experience.
That's a really neat product, because it kind of gives you back the control about what that depth of penetration is, so that you can ease back into it.
Absolutely. There are so many different things that can help. So I've also had women, because of dryness or that last encounter that wasn't pleasurable, feel a little bit anxious. And when we're anxious, what happens is we actually tense up when the vagina is not relaxed, then it actually causes it to be even more uncomfortable. And so really trying to find ways to ease that in, whether that's some gentle touching, caressing, or any types of stimulation. You can find, this will be my one thing to take away from today.
Okay, everybody listen up. Dr. Steele's takeaway
is intimacy will change throughout your lifespan. You can't help it, even if you're attempting to help with the physical part, but just because it changes doesn't mean that intimacy has to. And so part of that might be to adjust some of the behaviors, right? In terms of finding that different type of stimulation. If penetrative depth, even with lubrication, is painful, try some of that clitoral type of stimulation to help just have some type of pleasure. So it will shift, because it does shift for everybody. Nobody in their 60s will have sex like they did in their 20s. And that's okay. And it is fine to work through that.
I love that. And I'm going to add to it that I have so many patients who are in menopause. They're in their 60s, 70s, and 80s, and they are truly having the best sex of their lives.
A ton.
So just because it changes, it doesn't mean that it's less than it used to be.
Absolutely.
Yeah, I think so. There's the point that I often want to drive home during my appointments is that so many women go into survival mode during the midlife, and we want you in thriving mode, and having a sex life that you're happy with and that you can report is awesome is part of that thriving.
I think that many women go into menopause thinking that sex will stop after, and research just does not support that at all. And that goes towards expectations too, of it's okay for caressing and touching and for other types of behaviors to come into play. Many people are very sexually satisfied well into their 80s and 90s. And that is adjusting that you might not orgasm every time. And that's okay. That still means that your body is still producing, right? It's still engaging, it's still activated. So kind of those expectations too, of how are we defining what sex is? If it's lubrication and orgasm every time, then we might be setting ourselves up for having a hard time in the transition. Yeah.
There are a few questions coming into the chat about bladder infections, UTI-like symptoms after intercourse. And I'm glad that so many of you have felt comfortable sharing that. It is so common that during menopause, bladder infections, well, let me rephrase. Let me start again. Bladder infections can become more frequent in menopause and more likely to occur after intercourse. And part of that is because without estrogen, the architecture down there changes, and it's more likely, it's easier to get an infection, period. And then particularly during intercourse where there's rubbing, it's not hard for some bacteria to get up into the opening to your bladder, the urethra, and cause a bladder infection. So at minimum, avoiding going to the bathroom before and after intercourse can be very helpful. Washing immediately after intercourse, just to get rid of some of the bacteria that are there, is important. And there are prescriptions. So if this is happening, then please talk to your doc about it, because we definitely want to, that's something that's avoidable, and there's good resources out there to help it.
Can I add on to that?
Yeah.
I often find that people also experience a lot of stress and disappointment if they are trying products to help with dryness and getting UTIs after, because their body's not used to it. And so with different products, like different types of lubricants, there are so many different kinds. And so if you are finding that you are attempting to use some of these things and experiencing that, definitely talk to any of your medical providers, your women's health doctors, to try to find something that might help, because there's a lot more that are now coming on the market that are much more feminine hygiene friendly than some of the other ones that you might find at Walmart or Giant or things like that. 100%
agree. Lubricants are not all created equal. And particularly for that sensitive menopausal vagina, we want something that doesn't have a lot of preservatives in it, something that doesn't have alcohols in it that's going to dry you out long term. And a lot of what is available at your local stores are those things. So definitely I would talk with your provider or see us at the midlife center so that we can help you find a water silicone based product. So let's see, are there there's some questions about supplements that can help with libido, or hormones that can help with libido. That's a great one, because hormones do play a role in libido. And I know Dr. Steele wants to add her 2 cents, so I don't want to steal her thunder. But hormones are just, like, to use my analogy, they're one piece of the pie. And so to some degree, giving you back hormones, and it's particularly the male hormones that are more associated with our libido, there can be a role for that. However, there's not an FDA approved male hormone that is available in the US or anywhere. That doesn't mean that we can't compound it or use other products, but there's a lack of data about how safe these products are. And one popular type of treatment is using testosterone pellets, which over 3 months' time secrete supposedly time-released hormones that can help with libido. And those can be effective, but they're hard to control. And so if there's too much there, that can cause symptoms like hair on your face, acne, worsening mood. And once it's there, it's hard to remove it. So it's not recommended, though a product like that isn't recommended by the American College of OBGYN. But so there are some products, but they just, it's important to be thoughtful about what you're using and talk with your provider about what you're using.
I would absolutely agree with that. I know that some people, I think there's one I can't think of the name of, that I often get asked about in terms of what I think about it. And for some people, I think it could be helpful if that's the route that they would like to take and they've talked to their doctor. The other part that I'm kind of thinking of is that sex already declines after the first 2 years of marriage. It just does. And then declines even more after children and all of the to-do things. And so typically people experience decreased libido before they're in menopause. Mm-hmm. And so a menopausal supplement will not, a hormone supplement might not be the answer because chances are it might have been present beforehand. Mm-hmm. And so trying to use some of those other strategies, like what type of touch do you want? What type of supplements would be helpful? What type of stimulation is helpful? If we're not receiving, a pleasurable stimulation, then our body's not going to react. Mm-hmm. Whereas our level of depression and anxiety or stress and sex go like this. Mm-hmm. We can't be stressed and feel like we want to have sex. It's kind of one or the other. And so studies show that when those things are activated too, it does impact our body's response. And so if you have mood symptoms, you might not feel that pleasure in the same way. So making sure that, mental health is also being taken care of to help with some of those other mood symptoms.
Yeah, that's a great tip. And another, I've heard you talk about this study in menopausal women that had their hormone levels checked. Mm-hmm. And you would think that the women that had the highest hormone levels were having the highest libido. And was that the case?
It was not. It was kind of all over. And it went back to kind of that idea that how we think about the transition will go will really kind of tell how this transition goes. So if you're somebody who's thinking, oh, my sex life is gone, it's never going to happen, then it might be because now we're focused on other things. Whereas if we're in that problem solving, we're in that sensual space, it will be easier to engage in terms of really exploring, talking to partner, it being more about the connection, not focused on one specific avenue of the intimate encounter.
Yeah. Mm-hmm. So it's a pizza pie and hormones are one slice of it, but there's much more that goes into it. Mm-hmm. And that's why I think it's important to be able to talk to a provider, someone that you trust and feel comfortable with, so that you can figure out what slices of the pie you need to work on first. Mm-hmm. We have an amazing pelvic floor physical therapist that will be joining us for one of our chats coming up. And what she does with pelvic floor physical therapy has been life-changing for so many patients. And so there's so many products and resources out there. And it can be hard to know what ones are helpful and safe just by, doing that research on your own. So I hope that through this series of chats, you can identify the providers that are here to help you navigate all of that information and use find what works for you.
I think I saw something in the chat about asking about Kegels. It sounds like that would be a good chat for that person to attend, is with the pelvic floor.
So we've all heard, most of us have heard about Kegels and in the many ways it's beneficial. But for some women, their pelvic floor musculature is so tight that they don't really need Kegels. They kind of need the opposite of Kegels to loosen up and allow sex to be more pleasurable. So that's why working with a specialist is so helpful. And we're going to add that to the list of things that we talk to Terry Temecki about. All right. I think that is all the time that we have for today. We did make it easy for you to find more about our midlife services. You can use the QR code or visit the website that is coming up on the screen.